Thank you for joining me to review a summary of our results for the Fit Family Challenge. The first YouTube video covers an overview of the Fit Family Challenge, so I'm not going to spend time on that, but I am going to give you a summary of our results. So this slide shows the different measurement that we used for the Fit Family Challenge. So we first started off by asking all of the providers to complete an online survey that basically asked them about their knowledge and skills and opinions about pediatric obesity. So that was done at baseline, and also we did this at 12 months. We did regular tracking of BMI that was done at baseline and also at 12 to 24 months. We did changes in BMI, and again, this was a clinical assessment that was done monthly when the child came in to attend the group visit. So this was done both at baseline monthly, and then we did, again, a big data gathering at 12 and also at 24 months for those that were continuing to participate. Similarly, the same for blood pressure, for both diastolic and systolic blood pressure. That was taken on a monthly basis when the child came in for the group visit. We utilized the HeartSmart Kids assessment to determine changes for lifestyle factors. Particularly, again, we focused on the 5210 message. So changes in what they were doing around fruit and vegetable intake, screen time, physical activity, and sugar sweetened beverage intake. Labs were optional because we didn't provide any funding for this pilot study for the practices to actually be able to draw labs. So labs were optional. We encouraged the practices to follow along with the pediatric obesity guidelines of when to draw labs and which labs to draw, but we did not require those to be done. And then we did give out a Fit Family Challenge satisfaction survey to the child and parent at the end of the 12 months, and then ongoing for the children who participated past 12 months. Looking at our results, you can see that a couple different things. This breaks out our actual participants. So we had just about a 50-50 split in terms of the number of female participants and male participants. And you can also see that we actually had a significant number of our participants where Spanish was their first language. So almost 30% of our participants had Spanish as their first language. Fit Family Challenge, the materials for the child and parents, so the family materials are all available in Spanish, and we did have a number of our practices that actually had Spanish-only group visits for those particular families. We did have 21 primary care practices around Colorado that participated in the Fit Family Challenge. And we had 290 children plus their families that enroll in the Fit Family Challenge. And the mean age of the child that participated was 9 years. So then when we look at our clinical outcomes, again, we focused on changes in BMI, both percentile, and then we also took a look at Z-scores. And then we looked at systolic and diastolic blood pressure. And we broke it out between baseline 3 to 6 months, 6 to 9 months, and 9 to 15 months. And what you can see, particularly with the BMI percentile and the BMI Z-scores, is that between baseline and the 9 to 15 months period, we did see a statistically significant decrease in BMI percentile from a 93.8 to a 92.3 decrease. And then we also saw a significant decrease in BMI Z-scores from a 1.89 to a 1.77. So we were really excited about those particular results because other studies that have looked at pediatric obesity, many times it's been very difficult for them to actually show a significant decrease in either the BMI percentile or BMI Z-score. So we were very excited that our intervention was able to produce those kinds of statistically significant decreases in both the BMI percentile and the BMI Z-scores. Then you can also see that for both systolic and diastolic blood pressure, that there were not any statistically significant changes, and they basically stayed pretty much the same, which was not really surprising, looking at really the small changes in weight. This particular graph, again, just shows exactly what I just said, that there was a statistically significant decrease in BMI percentile, but there was not, that basically both systolic and diastolic blood pressure stayed the same. And then this next graph is actually looking at our BMI Z-scores. And again, what you can see is that we did have a statistically significant decrease in our BMI scores from baseline to that 9 to 15 month time period. When looking at our lifestyle outcomes, again, we use the Heart Smart Kids questionnaire that the child and or parent completed on the iPad, both at baseline and then when they would come in monthly for the group visit. And what you can see is that we had, for just about every one of our parameters, we had a statistically significant improvement. So our fruit and vegetable intake went up 1 serving per day from baseline to the 9 to 15 month time period. Again, that was highly statistically significant. Milk type changed a bit from a whole milk down to a skim milk, although that was not statistically significant. Physical activity of at least 60 minutes per day in looking at days per week went from a little under 4 days per week up to just about 5 days per week. So increased a little more than a day per week of getting in at least 60 minutes of physical activity. That was highly statistically significant in terms of that improvement. And family activity also increased significantly as well, which we were really pleased to see. It wasn't statistically significant, although it was close on decreasing hours of screen time, almost at that goal of decreasing at 2 or fewer hours of screen time. And then intake of sugar sweetened beverage, that also decreased significantly from baseline to 9 to 15 months. As did eating out, so number of times per week that the child and or family went out to eat also decreased significantly from baseline to 9 to 15 months. This just graphically shows you exactly the information and the data that I just reviewed. Again, looking at each one of the parameters and then doing the comparison from baseline and then 3 to 6 months, 6 to 9 months, and then 9 to 12 months. And that is the end of this slide set and the end of our results. Thank you.